Simplified explanation of diagram. Micturition control. The diagram shows how the brain and nerves control urination, micturition, through different types of nerves and receptors. 1. Pelvic nerve, parasympathetic, releases acetylcholine to act on M3 receptors in the detrusor muscle. This causes the bladder muscle to contract, leading to urine release. 2. Hypogastric nerve, sympathetic, releases norepinephrine to act on beta-3 receptors, relaxes detrusor muscle, and alpha-1 receptors, contracts internal sphincter. This helps store urine, urinary retention. 3. Pudendal nerve, somatic, controls the external urethral sphincter using nicotinic receptors. This allows voluntary control of urination. You choose when to urinate. Simplified concept. Micturition center in the brainstem, pons, controls bladder function. Sympathetic system helps you hold urine, retention. Parasympathetic system helps you release urine, voiding. Some drugs help manage bladder problems by targeting these nerve pathways and receptors. USMLE style questions. Question 1. A 67-year-old man has trouble urinating after surgery. Which receptor likely causes contraction of the internal urethral sphincter during sympathetic stimulation? A. M3 receptor. B. Alpha-1 receptor C. Beta-3 receptor. D. Nicotinic receptor. E. Muscarinic M2 receptor. Correct answer, B. Alpha-1 receptor. The alpha-1 receptor is found in the internal urethral sphincter and is activated by the sympathetic nervous system to cause contraction and retain urine. Why not the others? A. M3 receptor causes detrusor contraction, not sphincter control. C. Beta-3 relaxes the bladder, not the sphincter. D. Nicotinic receptor is in the external sphincter, controlled voluntarily. E. M2 receptor is not the main player in bladder contraction. Question 2. Which of the following nerve fibers is responsible for voluntary control of urination? A. Hypogastric nerve. B. Pelvic nerve. C. Pudendal nerve. D. Vagus nerve. E. Iliohypogastric nerve. C. Pudendal nerve. Explanation. The pudendal nerve carries somatic fibers that control the external urethral sphincter, allowing voluntary control over urination. Why not the others? A. Hypogastric is sympathetic for involuntary storage. B. Pelvic is parasympathetic for involuntary voiding. D. Vagus nerve does not innervate the bladder. E. Iliohypogastric nerve supplies abdominal wall, not bladder. Question 3. A drug that activates beta-3 adrenergic receptors is most likely to cause which effect on the bladder? A. Contraction of the detrusor muscle. B. Relaxation of the detrusor muscle. C. Contraction of the internal sphincter. D. Contraction of the external sphincter. E. Increased parasympathetic tone. Correct answer, B. Relaxation of the detrusor muscle. Explanation. Beta-3 receptors are stimulated by the sympathetic system to relax the detrusor muscle, promoting urine storage. Why not the others? A. Contraction of the detrusor is caused by M3 receptors. C. Internal sphincter contraction is alpha-1. D. External sphincter is somatic, not adrenergic. E. Beta-3 stimulation is sympathetic, not parasympathetic. Let me